Hello again, our dear viewers. As you know, today children's health has become a growing concern for many parents, especially with the increasing pace of life and the variety of health information available online. Knowing when to worry, when to act, and how to respond in emergencies can make a real difference in child safety and well-being. We are pleased to welcome Dr. Fajer Altammar, a pediatric specialized in pediatric intensive care and emergency medicine, and a holder of the Canadian board. Through her experience, she deals daily with critical cases and urgent decisions, giving her a deep understanding of the real concern parents face. Today, we will discuss common questions that matter to every mother and father and provide practical medical guidance to help parents feel more confident and well-informed. And with that, please welcome with me Dr. Fajer to the show. Welcome, Dr. Fajer.
Thank you so much, and good morning to you and to all the viewers.
Good morning to everyone watching us, and we are pleased to have you here with us in Good Morning Kuwait. And to start with, like, the topic that a lot of people are concerned with, which is like the safety of our children. So what are some of the misconceptions people have when it comes to taking care of, like the children themselves?
Yeah, so children are so beautiful, and most of the times they're very healthy, they're full of life, they want to do fun things and sometimes crazy things too.
Exactly.
What I notice is that some families have misconceptions that we really hope to clarify. One of the big ones is that some people don't understand that kids can actually get very, very sick. Now, we don't want to let the viewer worry, but it's important to be informed. What are the things that they should look for in their child? When do you seek care from a doctor? And when not to actually just go on the internet and ask Google and ChatGPT. When to actually know when the signs are important and when to seek for help.
That's really very important, especially like nowadays with a lot of people going on social media and giving like advices. Some of them like have really great credentials, and some of them just like based on their own experiences. So in your experience, when is like the real time for parents to seek help like there's something wrong with their children?
Yeah, so I always say one of the most important gifts that Allah subhanahu wa ta'ala has given is intuition. And a mother's intuition is important. So specifically moms and dads, if they feel in their gut, in their gut that there is something that is not right about their child, don't ignore that. At the same time, we don't want to be too worried and anxious and bring the child to the hospital.
And then, like paying attention to every detail.
Exactly. So we want it to be average, but listen to your intuition. So important things to look for are breathing difficulties. If the child has abnormal sounds during breathing, that is something that they should seek help for. If their child is unable to drink a lot of fluids over time, then they need to be, and have signs of dehydration, then they have to seek care as well. Other important things are if they have any signs that there's significant weakness. For example, a child cannot move their feet or their hands, or that they can't stand up, and it's something that is getting worse over time, definitely seek care. And one important thing as well that people think about is they worry about fevers. So fever is an important sign that the child is fighting an infection. That in of itself is not super worrisome unless it's associated with other signs and symptoms.
This will like show like to the parents themselves like his defensive mechanism is working fine. It's like a test.
Absolutely. It's like their defensive mechanism is working. But fever with other signs, like if a child is so weak and they can't drink any fluids and there's signs of dehydration, saying that the body needs some help, or there's problems with how wakeful the child is, and is the child smiling, or is the child just crying irritably without the mom and dad being able to console them and make them comfortable. So I think a lot of signs and symptoms, we call them symptoms, are like complaints, concerns together. They should seek help.
That's really very important for all the parents that are watching us. Like knowing when to seek a help is very important, so you can save the life of your children. And sometimes, like when you're dealing with the children themselves, like some parents, they get hesitant of taking action by themselves. They think like they might like add like extra like negative effect to the child rather than helping them. So what do you advise for them?
So I think in everything in life, so, whether it's regarding the care of children, is that it's always good to be in the middle, right? Not to worry too much and not to dismiss symptoms too much. So I think seeking care, asking somebody with more experience. And in Kuwait, we have physicians everywhere. We have polyclinics. Our infrastructure is so grand that there will always be somebody to help. So when in doubt, ask for a friend and ask specifically for your friendly doctor to tell you whether this is something serious or not.
Of course, and you know, like with every season, it has like its own illnesses and diseases.
Absolutely.
So in like winter right now, like what are the most common diseases that children could get affected with?
So like adults, us grown-ups, you know, we have the influenza. I'm recovering now from a really bad cold. So it's the cold symptoms, runny nose, throat congestion, throat pain, headaches and fever. These are the common ones. But in children, specifically the kids who are less than 6 months of age, there's a specific virus called the RSV that causes really bad lung infection. Not to all the children, for a small subset of kids who I like to say that they're very sensitive or fragile, that they might have this regular virus that gives us a cold but gives them a really bad infection. So in my area of specialty, the ICU and emergency, is that we do see a small number of kids who need some extra help from a simple cold. So this winter season, the most common infections is the influenza viruses, the RSV. It's the infections that give us cold and respiratory symptoms. And it's important to mention, maybe this is a wonderful opportunity, is to use the normal things that we do for protecting ourselves from infection, right? Like if you're sick, don't go out and meet people and sit in gatherings in a small space.
Like isolate yourself.
Exactly, isolate yourself, all the things, Allah la Eid al-Shar, you know, during
like
COVID
Corona.
times, right?
Yes.
Exactly, so hand washing, keeping a distance, and making sure that you use the normal hygienic ways to deal with cough and runny nose and all of those symptoms.
That's very interesting, like for the adults, so they can take these practices to prevent themselves.
Exactly.
And when we talk about like the children, like for the parents, what are some practices that can help them to reduce the illnesses, infection?
Yeah. So an important one is if the child is sick, don't let them go to school. You know, and let's be honest and practical. Oftentimes we have work, right? And we need to make sure that the kids are in a safe space. And we minimize some of their simple symptoms and say, you know, كلها نشلة, it's just a runny nose.
لا تدلع, go to school.
لا تدلع, go to school. But we need to be conscious that a sick child is in a classroom might infect other friends. And not everyone has a strong immune system. Some kids have, you know, significant chronic diseases that they cannot afford to have a simple virus. So I think, you know, we have a duty and a responsibility to the community to protect them. And myself and the team that I work with, it's our duty to try to share these messages of prevention. So simple things, don't send your child who's sick to school, and try not to have, you know, big gatherings or send them to family members when they're sick.
Of course, that's one of the misconceptions people do, and like the mistake parents do when they deal with their children, that they don't take it seriously and they think it's like something normal. However, it could lead like to something even bigger. And with that, there are some children that they go like to the care, you know, like daily care, because of like some simple disease. But there are some children that go to the emergency. And in your experiences, what are the difference between, or that lead to some children like go to something normal and the others to be like in the emergency room? Yeah.
So that's a wonderful question. And I will answer it with actually evidence and data, because I believe that data is everything. So in my capacity as an emergency room physician, I was recently also the head of pediatrics in Jahra Hospital where I work. We know for sure that about 90 to 95% of children who come to the pediatric emergency department have a simple illness, which is wonderful. This is what we want. We want our kids to be safe and well.
Exactly.
What that means is there's a big opportunity for primary health care to help support these children. And I know that we all see this, right? When we go to primary health care, mustawsafat, it's also very busy there.
Yes.
But knowing as a parent myself as well, is what are the things that I would much preferably have my child be seen in the primary health care as opposed to emergency department, helps us focus on where do we put our resources and how do we utilize the resources. So number one, I'm always happy to see that there's a lot of kids with minor simple illnesses come to the emergency department because we want them healthy and well. But at the same time, I think we need to think about utilizing an amazing resource that we have to the best of our abilities.
So when we say like amazing resources, like could you give some examples?
Sure. So in Kuwait, you know that we have primary health care,
yes,
which is available in all of the cities in Kuwait. And even the primary health care has then a secondary level of care.
Oh, okay.
So utilizing that is important. Obviously, I like to talk about my own specialty, but this pre-hospital, pre-emergency department visit, there's a way to provide care that way as well. Now, That doesn't mean that worried parents should not come to the emergency department. We are open 24 hours. We love to see our patients. We love to care for them. But knowing which types of symptoms and questions and queries and going where is always better and easier.
Exactly, and in that term, like some, it's like kind of a message for like also the parents and also like the physician themselves.
Yeah.
Sometimes like there could be like a minor illness or symptom. However, the way it's being presented could make it like exaggerating.
Correct.
And lead like to the parents to have like exaggerated reaction.
Yeah.
So in that term, how you can really present the like the symptoms in a way that doesn't make the parents overreact. At the same time, how you can deal with overreacted parents.
Yeah. So this highlights the important, crucial role of effective communication. The best physicians, the best healthcare professionals are those who are able to listen to parents, absorb their worry, and address their concerns in ways that makes them understand and appreciates that this physician cares. So I think the most important thing is really addressing their worries, addressing their care, their questions, and trying to clarify what is this illness, what to worry from. And I've noticed over time and experience that makes a big difference with worried, anxious parents. And the most important thing that I highlight to the people I work with and to parents is to give them clear guidelines and things to look for so that the family know, okay, if this happens to my child, then I need to come and bring them to the emergency department.
Okay.
So very clear discharge plan, points to keep track of, and give them, this is the trigger for when you should come here, and these are the things that you can go and seek care elsewhere.
That's really important. And I think like that's worked very well for the parents, so they can have a state of mind and calm and peace at the same time, and doesn't overreact or like exaggerate the situation itself. And since we are talking about like a plan, like an interesting actions, there are some first aid that could really be very severe, like in time consuming, and helping the children, like that doesn't make their situation exaggerated. So what are the simple first basic aid that every parent should be like informed with? Yeah,
I love that question because it's so important that every household has to have somebody who can give that additional care if needed. As simple as, la samahallah, if there's, tea, chai that falls on someone's skin, what are the first steps to do to provide care? If there's some sort of bleeding, what do you do? If something happens at home and someone collapses, how do you address this? And I always try my best to, even friends and family, even teach the children early on what are the major concepts of providing first aid and basic life support. So I think it would be amazing to see our community in Kuwait start to apply this, and there's a lot of people who are training families and even in the workplace on how to provide first aid and BLS. I think just reinforcing that and letting them know what are the things that you can do at home, and again when you have to come and seek care.
That's really lovely, and I like how you mentioned about like teaching the children themselves, the kids, so how they can take care of themselves as well, like be independent.
Absolutely.
That's really important. And as you know, like sometimes when we talk about like the emergencies, the cases for children differ from the adults. In which way, if you could elaborate on that?
So they, there's a saying that people say that is not true, that children are small adults.
Small adults.
Yeah, so a lot of people say that, and it's actually not a true thing. So children, they obviously vary in size. A little baby who's just born is very different from a 2-year-old.
They're more fragile.
Absolutely, very fragile. How their body, the structure, the organ systems is different. How they show signs of disease and illness is different. And then the communication is different. Somebody who's a grown-up or an older child can tell you, my tummy hurts, my stomach hurts this place. I have pain in my shoulder.
They are able to detect where like the issue is.
Absolutely, so they can communicate to us where the problem is. So there is some sort of direction. When it comes to children, often it's not specific. You don't know where exactly hurts. Is it getting better or worse? So the doctor who is specialized in children, pediatricians, need to be smart and experienced on how they pick up these signs to put them together into a diagnosis. And of course, the most important thing is the role of the parents, because the parents are the people who understand their kids more than anyone else. Sometimes you have a little baby who's crying, you know that this is a cry of hunger. well, this is a cry, that suggests that they are in pain.
Interesting. So
Right?
that's not where we go to the mother's intuition.
Exactly, absolutely. It goes back to the mother's intuition.
Mother's intuition. So
Yes.
mothers like have advantage over the father in
Yes.
that cases to understand that and
Yeah. And we don't want the
distinguish.
fathers to be upset at us. The fathers are amazing and we need them for families, but the mother's intuition, I've noticed. So many times I have had moms in the ICU tell me, دكتورة فجر أنا حاسة إن ولدي في شيء. Means دكتورة فجر, I feel like my son, there's a problem. Before anything changes in their vital signs, before we see any abnormalities in their blood work or their examination, I trust moms.
That's
Mom-
really lovely.
yeah.
And in that term, like unfortunately, not all the moms, like provide
Yeah.
care and be like really connected to their children. Especially like nowadays, some of them like they have housemaid.
True.
So she just come from work. She see like the housemaid having like some issue with a
Yeah.
child, and then she take it to the
Yeah.
medical like department.
Yeah.
In that case, it's like the connections not, or maybe like the mother's tuition, not that supportive or like strong.
Yeah.
In that,
That's a
cases.
very good point. To, on the contrary of what we're saying is that we see a lot of this. Even in clinics, for example, the mother will come and she doesn't know what's happening with the child, and she will ask the nanny, the housemaid, the caregiver, all of the questions that we want to know. It's important not to judge those situations, but I think we have a lot of work
Something
to
kinda
do
common.
as a community to make sure
course.
that moms are supported and that the moms support their children. And of course, again, a big role still relies on the father. I'm not saying it's just the mom who's
Responsibility.
exactly. The responsibility is shared, and everyone's perspective is very important for the child's safety and the child's health and well-being.
Of course, definitely. And with that, like, what one final advice you would like to share for the parents so they can better prepare themselves to react and also like take care of their children in different situations?
Yeah. So, in my role also as a ICU doctor, I see the sickest of the sickest children. And oftentimes people think that we never thought that a child can get this sick. So there's children, I put them into two categories.
Okay.
The things that we can prevent
Okay.
and the things that we cannot prevent.
Interesting.
وطبعا everything happens بإيد رب العالمين. Of course.
Definitely.
But things that we can prevent are, for example, safety when it comes to car safety. Can't prevent an accident happening. However, I can prevent it from being severe if we put the child in the proper car seat. Seat belt, exactly. Having a child on a buggy, ATV, under 18 years of age, that's not
Risky.
correct. That's risky, and that is not the proper behavior. That's prevention. So things like that, try to work on preventing, keeping your children safe, jumping up and down on super high couches, high places, falling down, hurting your head. Those are things that, with proper supervision,
we can have control of.
Exactly. Not on everything, but we can do our very best.
As much as possible.
Exactly.
Definitely.
And then the other one is diseases. So if we make sure that kids are getting their vaccines at the right time,
Eating healthy food.
eating healthy food, sleeping well, all of the things that are crucial, even for us adults. If we make sure that that is available, then we prevent other diseases.
Strengthening their immune system.
Exactly, strengthening their immune system. However, there are things that you can't do.
Still, yeah.
Right?
How much you do, how much you are worried, and how much you are cautious about is still happening because of like
Exactly.
some.
Yeah. So we
order
do our
from
best.
God.
We
Yes.
do our best to educate. We do our best to try to recognize disease early on. We do our best to provide the best care. وشفاء بيد رب العالمين, right? We recognize, we treat, and as physicians, it is our role to make sure that we are updated with the best knowledge and have the best opportunities to provide the best care for children. And for me, this is my personal mission. And why we're here today is to hopefully share some important information for parents.
Exactly, and that's really a very lovely and concise message that you have shared to the audience and the parents especially, so how they can take a better care of their children and to have like really a safe and fulfilled future. Thank you so much, Dr. Fajer, Altammar, Pediatrics, Pediatric, ICU, and Pediatric Emergency Specialist. Thank you so much for being
Most
with us
welcome.
and informing us about this beautiful topic.
It's my pleasure. Thank you.
Thank you. And with that, our dear viewers, after this really lovely interview, now we're gonna take a look at some of the report. Some textiles are more than fashion pieces. They carry history, identify, and generation of craftsmanship, Kashmiri shawls and are perfect example of what legacy known around the world for their elegance, softness, and exceptional handcraft, made from rare natural fibers and crafted through meticulous traditional techniques. Each shawl reflects the skill and patience of Kashmiri artisans. Let's take a look at the report and then we're going to be back. So stay tuned.